Hey everyone, and welcome. If you're a medical trainee, you are on the front lines of one of the biggest health challenges we face, obesity. So today, we're going to open up the essential preoperative playbook for bariatric surgery. We'll break down everything you really need to know before your patient even sees the inside of an OR. First, let's just get some perspective. See this number? 650 million. That's the staggering number of adults around the world living with obesity. It is a full-blown global health crisis. And that's exactly why understanding every single tool we have, especially metabolic surgery, is so critical for your future practice. So here's our game plan. We'll start with the big picture, the scale of the problem. Then we'll dive right into the key clinical questions. Who's a good candidate for surgery? And, just as important, who isn't? From there, we'll walk through the whole multidisciplinary team assessment and then cover the final steps to get a patient ready for a really successful outcome. All right, let's kick things off with why this matters so much. Beyond the health problems for any one person, the sheer scale of this epidemic has massive societal implications that every doctor needs to understand. Now, this tells a huge part of the story. We tend to focus on the clinical side of things, right? The comorbidities. But when you see a number like $200 billion a year, just in the US, it puts the urgency into a whole new light. This isn't just a health issue, it's an enormous economic burden on the very system you're about to work in. Okay, let's get to the question you'll face in almost every consultation. Who is actually a good candidate for bariatric surgery? The guidelines have changed a lot over the years, so it is absolutely crucial to be up to date on the latest indications. And you can really see that evolution here. The thinking has shifted dramatically. From those first criteria back in 1991, the evidence has just kept piling up, pushing for broader, more inclusive guidelines. And that all led to the big update in 2022. The data is clear, surgery is an incredibly powerful tool, and now we can offer it to more people who really stand to benefit. So let's break down the new rules. The first indication is pretty straightforward. Any adult with a BMI of 35 or higher is a candidate, period. At this level of obesity, the sheer stress on the body is so significant that the benefits of surgery are thought to outweigh the risks, even if other health problems haven't shown up yet. Now for the second group, and this is a big one. We're talking about patients with class 1 obesity, that's a BMI between 30 and 34.9, who also have type 2 diabetes. This is so important because it reframes the surgery. It's not just a tool for weight loss, it's a primary disease-modifying treatment for diabetes itself, a real game changer. And the third indication opens the door even wider. For patients in that same BMI range, 30 to 34.9, surgery is an option if they have other serious metabolic diseases. Think hypertension, severe sleep apnea, and, this is key, if they haven't been able to get sustained weight loss with non-surgical approaches. It's a recognition that for many, willpower and lifestyle changes just aren't enough. Okay, this table right here, this is your clinical cheat sheet. Seriously, it lays out the 2022 indications super clearly. You've got the BMI thresholds and what comorbidities are needed right there. It's a perfect reference to have handy when you're seeing a patient in clinic. And this quote, this is a huge clinical pearl. It points out a classic trap. So what happens if your patient works really hard and loses some weight before surgery, maybe dipping just below that BMI cutoff? Well, the ASMBS is very clear. That should not disqualify them. You have to remember, obesity is a chronic disease. That initial success is awesome, but it's often not sustainable long-term without the help of the surgery. So we've covered who is a candidate, but it's just as critical to know who isn't, or at least who isn't ready just yet. Spotting these contraindications is a crucial part of keeping patients safe. These right here are the absolute stop signs. We're talking about things like untreated major psychiatric disorders, active substance use, or severe heart disease that makes anesthesia way too risky. Now, this doesn't always mean never, but it definitely means not now. These issues have to be managed and stable before surgery is even on the table. And that last point about being unable to comply is so important because the surgery literally changes their anatomy forever, and they have to follow a strict nutritional plan for life to avoid serious trouble. Okay, so your patient meets the criteria and has no absolute contraindications. Now the real work begins. And let me tell you, it is not a solo mission, it is a total team sport. This multidisciplinary assessment is the bedrock of a good outcome. This right here is really the heart of modern bariatric care. The operation itself, it's just one piece of a much larger puzzle. Real, long-term success is built on a whole program that supports the patient's nutritional, psychological, and medical needs before, during, and for years after the surgery. And here are the key players on that team. Of course, you've got the surgeon, but you also have the dietitian, who's the expert on their new nutritional reality, the psychologist, who makes sure they're behaviorally ready for this huge life change, their PCP, who helps coordinate everything, and the specialized nurses and doctors who guide them through the whole process. Every single one of these roles is vital. So the psychosocial evaluation really boils down to one question. Is this patient truly ready for this? And it's not about passing judgment at all. It's about finding potential roadblocks, like undiagnosed depression or unhealthy eating patterns, and then giving them the support they need to work through those things and be successful after surgery. In the same way, the dietitian's job is to figure out the starting point. What are the patient's current habits? What vitamin or mineral deficiencies do they already have? Because those are super common. This lets the dietitian build a personalized nutrition plan for lifelong health after the operation. And finally, the medical assessment. This is all about safety and optimization. It means screening for things like obstructive sleep apnea, checking out their cardiac risk, and getting conditions like diabetes under the best possible control. The goal is to make sure the patient is in the absolute safest shape to go through the procedure. All right, the patient has been through the whole evaluation and they've been cleared by the team. We are in the home stretch. These are the final actionable things the patient has to do to get ready for surgery and really set themselves up for success. Think of this as the patient's pre-op checklist. It's a clear, evidence-based protocol. Quitting smoking is huge for cutting down on complications. That low-calorie diet, it can actually shrink the liver, which makes the surgery technically easier and safer for the surgeon to perform. And prehab, or exercise, just gets the body stronger and more prepared for the stress of an operation. Now look at this chart on smoking for a second. This is fascinating and a little scary. Patients are awesome about quitting right before surgery. The rate plummets down to about 2%. But then, look what happens over the next 7 years. It creeps right back up. It's such a powerful reminder that these lifestyle changes aren't a one-and-done thing. They need lifelong support. Here's another super practical, can't-miss takeaway. Estrogen increases the risk of blood clots, or VTE, and that risk is already higher in patients with obesity. So to bring that risk down, the guidelines are crystal clear. Stop oral contraceptives a full month before surgery, and stop hormone replacement therapy 3 weeks before. So there you have it. The patient has been evaluated, they've been cleared, and they've been meticulously prepared for what's to come. They've done their part, the team has done theirs. They are officially ready for the operating room. And that leads us to the final question. What are the surgical options that are about to change their life? Well, that's a great topic for our next explainer.